welcome back to my channel. If you've never seen my face before or you've never heard this voice, my name is Cassie and thank you so much for tuning into today's video. So in today's video, as you can see, we are doing a dental cleaning. So this is my friend who volunteered for the channel. She also already needed cleaning, so we figured we might as well film it, and I hope that you enjoy. So first thing we do as we're preparing for cleaning is make sure that the instruments we have are sterilized, get a fresh mask, some fresh gloves, that way we can hop in with all brand new and freshly sterilized equipment. First up, I'm jumping straight in with the ultrasonic scaler. The one I'm using is called a Cavitron, and it uses gentle vibrations and water to break up plaque and tartar quickly. So, you know that stuff that likes to get stuck on your lower front teeth? We call that either tartar or calculus. So it starts off first as plaque. That's when it's soft and kind of mushy. And once it's hard, we call it either calculus or tartar. Essentially what it is plaque that's been sitting for too long and has hardened and become stuck to the tooth. No matter how well you brush or floss, only professional tools like this can remove it. So some patients actually hate the sound of the ultrasonic scaler. They find that it makes like a screeching kind of noise or like a really loud squeaking noise. And for some patients, the noise kind of reminds them of a drill, and so they hate it. I often like to encourage my patients to come in with their headphones or their AirPods, and they can pop them in during the cleaning, turn their music up as loud as they'd like. This way they don't have to hear the sound as distinct. I also like to play some jazz music in the background. That way it buffers the sound a little bit for those people who maybe don't want to put headphones in or have forgot them at home. And I find that doing this also helps a lot. I really care that my patients are comfortable. I really care that they're feeling like they're at ease in the dental chair. And so I always encourage them, if they ever just need a moment or if something is feeling uncomfortable, that they just lift their left hand. I freeze and I check on them right away. And so there are different ways to approach it, but this is usually what I like to do. So you'll see that I am going back and forth between the ultrasonic scaler and the hand scalers. And so I like to do this because whenever there are big chunks of tartar or calculus, I like to pop them off and get them out of the way rather than breaking them down with the ultrasonic scaler. It truly depends on the patient and the tenacity of the calculus that they have. I find that if it's something that I can pop off of the tooth, it makes it a little bit more comfortable and a little bit easier to just pop it off and then follow up with the ultrasonic scaler. So the hand instruments help to fine-tune areas that the scaler might have missed, or in my case, like I said, I like to pop off the chunks and then kind of go back in and get the whatever is kind of like left over in terms of debris. And it helps to really just make sure that everything is clean and smooth. Have you ever noticed that your teeth feel slick after a cleaning? Well, that's because we've removed all of that rough buildup where the bacteria loves to hide. That smoothness makes it harder for plaque to get stuck again. And so that is one of the goals that we are trying to achieve as we're cleaning the teeth.
So sad when love will make you do all the things that we accept, be the things that we regret. So all of my ladies, hear me, come on, sing with me. See, when I get the strength to leave you, always tell me that you need me, and only 'cause I believe meet you, and I'm mad because I love you. So I stop and think that maybe you can learn to appreciate me when it all remains the same. That you ain't never gonna change, never gonna change, never gonna change. My days are cold, baby, and my heart can't take no more. No more, no more. See, my days are cold without you. And my heart can't take no more. No more.
Now that the surfaces of the teeth are clean, I like to floss between the teeth. Even if you floss at home, and honestly a high five if you do, we always check to make sure that the spaces between your teeth are healthy. And using floss after completing use of the ultrasonic scaler as well as the hand scalers just makes sure that if there are any small little particles of anything that kind of got stuck in the gum tissue, you're able to get down there with the floss and loosen those up. Although the instruments are nice and thin for the most part and you're able to get everything out, there are moments where there are tiny little pieces that kind of just are floating in the space, and so depending on how the teeth come together, getting the floss in there, just make sure that you are not leaving anything behind at all. Okay, so last but certainly not least, we are polishing the teeth. And so I use a spinning cup and a special paste that has grit in it, which are called a Profi Angle and a Profi Paste. This helps to remove surface stains from coffee, tea, soda, juices that have dyes in them, and also some foods that have spices in them that also like to stick to the teeth. This helps to make your teeth feel extra fresh. This is also usually people's favorite part of the cleaning. Some people hate how gritty the paste is, and so some people don't necessarily love the Profi paste and the polishing, but I always like to remind people that usually when we get to this part, we're at the end of the cleaning and you get to rinse and spit and get all of that out of there. So before we end today's video, I want to give you some tips and some tricks for keeping your smile bright and healthy from home. So you want to make sure that you're brushing at least twice a day for 2 minutes each time. You can either set a timer, or my favorite method to recommend is to play a song that you like that's at least 2 minutes long and you'll brush to the entire thing. And by doing this, you're able to allow the toothpaste to truly activate and do its job, and also remove things that may have gotten stuck on the tooth surface throughout the day. You also want to be flossing at least once a day. Your gums will thank you. And if you're doing it once a day, I do suggest to do it at the end of the day before you get in bed. That way you remove things that may have got stuck in the gums or in between the teeth. This will also help to prevent you from getting cavities that are in between the teeth. We call those interproximal cavities, and so you really want to make sure that you're getting in with your floss before bed. I also want to recommend that you don't skip your 6-month checkups. Usually at these appointments, we're able to catch problems before they become big ones, so just make sure that you're not skipping out and that you're going in for your 6-month routine checkups to make sure that everything is going okay. So as you can see here, I am going over those lower teeth one more time. There are some cases where I like to go over with the water again just to make sure that I got all of the grit out, as well as just make sure that there's nothing that's stuck between the teeth. And so now I'm going to sit my patient up. I'm going to give her a cup and I'm going to allow her to swish and rinse and get everything out that may have built up as we did the cleaning. So I want to take this time to thank you guys so much for tuning into today's video. If you have any questions or something you've always wondered about dental cleanings, drop them in the comments below. Thank you so much for tuning in, and I'll catch you in the next one. Bye.